Our new cases today totaled 73. It brought us up to 16,593. We had 2 additional deaths. In terms of the state in general, 56% of the new cases are coming from the Baltimore metropolitan area, and 11% of the new cases are under 19 years old. It wasn't that long ago when over half the cases were coming from Montgomery County and Prince George's County, so this is a real shift in where the cases are coming from, and there's also a shift in the ages. So the good news is we've plateaued and we're not on that steep slope running upwards, but it continues to be an issue as long as we can't bring the cases down. And to do that, we're increasing the number of tests we give. We're testing more broadly in the community. We're partnering with community groups that may have better access to some hard-to-reach communities than the county government normally has. We're looking at a variety of different ways of expanding our reach.
There's been lots of questions about, well, what data are we using to drive our decisions? We're continuing to look at the data dashboard that's open and accessible to the public, in particular as it relates to young folks, as MCPS announced this week that they would be all virtual during the fall. The reality is when we look at where we are, as the county executive pointed out, we've made tremendous strides to get to the point where we're averaging 70 cases a day. But to level set where we are right now, when we made the decision to close schools because we thought it was an increased risk for kids and staff members, and when we made decisions to close down large segments of our population, can you guess what the 3-day average was back then in mid-March? It was 4 cases a day. So we've made a lot of progress, but we still have a long ways to go before we can make sure that we can open up any other aspects of our society, whether we're talking about schools, athletic venues, those kinds of things, because we need to see the burden of the virus drop even more so that we can feel that when we do open up and make provisions for those things, that we can do so safely and minimize transmission.